first of all, we want to know that what is the epilepticus stage? It is like a series of seizures between the patients do not like regain the consciousness. It's like the patients will be in the coma, so we will be expect that like the tendon reflexes will be depressed, these pupils will be constructed, and the eyeball, it was like the floating movements. His eyeballs will be like floating movements. It can be like something we can expect that the progressive cerebral edema, like very sharp edema in the brain, when it is can be because of the compressions of important centers on the medulla oblongata. What we can expect that from the patients in the cardiac arrest and respiratory arrest, I will talk about it while we are doing the treatment. We must check these vital signs too. Status epilepticus, actually, it can be convulsive status like the major mirrors. It can be like 3 seizures interrupted by the consciousness or single prolonged seizures, as I said, that greater than 1 or 2 hours. Or it can be like the wavy stupor, like absence or petit molly status. It is like the complex partial psychomotor, which are prolonged alternations of the consciousness. And it's when we wanna this requires the therapy. It requires the very quick emergency requirements, and we have to consider 3 things when we are treatments the patients with this. We have to very fast end these situations, this epilepticus stages, and then we have to make sure that this seizures not come back again. It's not happens again, and the treatments, it should be like in undergoing the causes. This is the next slide. Okay, this is the how we can measure, how we can treat these patients like this. First of all, we can do it like local therapy, like at home or on the street. Should be prevent or like eliminations of the mechanical due to the tongue restriction and any respirations of the vomit, and possible to Bragg's convulsions. For this purpose, it is necessary to fill the oral cavity and the frenulum body to vomit that or something like that. Then we can do, as I read it, we inject the Lora's pump intravenously over the 1 to 2 minutes, and we'll repeat it if there will no response to that. We will repeat it after 5 minutes. We will repeat it, and it go on 2 ways. It's like additionally emergency drug therapy may be required if the seizure is stopped and the etiology of the status epilepticus is rapidly corrected, or we will go and inject another medications. Like first lines of withdrawal, we will drawing analysis for this level. We will push the 50 cc of the dextrose intravenously and 100 milligrams of the thiamine also intravenously. As I said, that we will be checking the vital signs of the patients to make sure that it's stopped or won't repeat again. And we protect her airways, his tongue to not swallowing anything, and we will repeat it. If the patients cannot, if we fail in this line of treatment, we will use the tube, like intube the patients if this first line failed. And we can have non-specific treatments, like we will checking like the electrolytes imbalance, like acidosis, lower seizures threshold, which is straight within the bicarbonate. If the pH is less than 70, and we make this fever become lower, we can use also antibiotics, and we use the neurologic exams, like treatments underlying cause maybe the process country. We know that the cause of the epilepticus status, it can be different. Like it can be in the children. The main cause is in infections. When they have infections and fever in the children, but in the adult, it can be like with like a stroke. Like when something is in their blood is imbalance. It's not in is imbalance. Like low blood sugars. And also there is another things like when these patients drinking too much alcohol withdraw after the previous heavy alcohol use. Actually, there is one of these risk factors of the status epilepticus when it is like low blood sugars, stroke, like drinking alcohol or drug abuses, and something which is related to cause them. And the next one is the hypertensions. We have to maintain the BP, blood pressures of the patients, because it will be unstable in these cases. And as I said that in the first slides, we will starting this treatment like diazepams over the 1 to 2 minutes and repeat it after 10 to 15 minutes. And we will change the doses, like first with the 10 milligrams of the doses intravenously, and if we didn't get any results, we will be increasing the doses up to 30 milliliters and repeat it for 2 and 4 hours. Good result is easy, the fast acting and short lasting. If 2 doses fails to stop this status, then the partial doses probably won't work either. So this is side effect. We will face this to the side effect. Your patients will be like bradycardia. His his heartbeat will come less than 60. We will face the bradycardia, and his breathings become like depressing respirations, cardiac arrest, and his mental status also it can be decreasing, depressed. Or we can start to using the lorazepam in this case, and we will also repeat it, but with 4 milligrams and intravenously, like 4 minutes, maybe repeat it. It also is fast acting and medium lasting, but only these respiratory depressant only in these patients they don't use these tubes for their better respirations. Also, then we can use the phenytoins, but only in 12 to 3 milligrams intravenously, and this is the presently used to the with this benzodiazepine. It is the pH is 12, so all intravenous fluids are the pH is like between the 4 to 6, and do not add this when this fails. This dextrose drops as it's prescribed. We shouldn't use it, and we also after injected we also should again check this blood pressures, and we have to start monitoring the ECG, the electrocardiography of the heart. The next one we have to use this for treatment is intravenously valproate, and it should be like that. Also should be repeated. Generally, because it is like the lack of the experiments, good result in the both major and the minors, it can be not have the good result, because it is like this fast acting and the long. For the long time, it can have this effect on the patients. For the less, it can has, because it's long acting, it can may have like more side effect on the patients. For becomes less than, we can use this diazepam, and also dilantin, especially in the unstable. When we check this, monitoring the patient's vital signs, we will see this the cardiac is stable, and the all hypertension, blood pressures, respiratory, all is stable. We can use this medications. Other drugs I can use is listed here, as you can see, intravenous midazolam and intramuscular parathyroid in the children. When this venous access is unavailable, We can use this all drugs rectally, rectal diazepam. We can use also propofols intravenously, and neuromuscular blocking agents also is the drugs we can use for this patient. And thank you for your attention.